Welcome on board. The health sector was on Monday hit by another walkout as clinical officers made good their threat to join the doctors' strike. Doctors have been on strike since March 14th over pay and working conditions. No end is in sight. The Kenya Union of Clinical Officers had last week issued a 7-day strike notice for their grievances to be addressed. Otherwise, they walk off the job until further notice. Our reporter Antonio Sundwa tells us more.
As the Easter season comes to a close, patients across the country are waking up to another twist in the already complicated situation in the health sector. Kenya Union of Clinical Officers KUSO have joined the striking doctors, announcing the start of the strike on Monday when they advised Kenyans to seek medical services from private facilities and other providers as clinical officers in national and county government hospitals began an indefinite nationwide strike on Sunday night.
On Wednesday, that is that of this month of April, all the clinic officers from this country, we are inviting them to Nairobi so that they can come and try and see if probably the Ministry and Council of Governors will be able to give them the answers that they have refused to give us.
At a press conference in Nairobi on Sunday evening, KUSO National Chair Peterson Wachira said that the strike is a response to the inaction of the Ministry of Health and Council of Governors in addressing their grievances despite negotiation dragging on for years.
Despite court orders mandating engagement and a resolution, the Council of Governors has repeatedly failed to cooperate, leaving us with no recourse but to escalate our action.
Wachira added that clinical officers have been forced to resort to industrial action after years of unresolved negotiations with the government over the new collective bargaining agreement CBA and other critical issues that have hindered the delivery of quality health care services. The clinical officers' key demands include the issuance of permanent and pensionable employment letters to staff hired for universal health care coverage UHC and the COVID-19 response. They also cited a failure to address stagnation in career progression, implementation of a previously agreed risk allowance, approval of career guidelines, and delays in providing comprehensive medical cover.
It is our position that the Ministry of Health adhere to 2020 approved internship staff establishment guideline by the Public Service Commission.
For 6 years, this person does not have a pension, is being paid half pay. You don't have annual increments. They are basically losing their 6 years of service just like that.
The Union Secretary General said some clinical officers have not been promoted since the introduction of devolution in 2013 and accused the government for collaborating with the private sector to kill the public sector.
Some have not seen promotion or even redesignation since the devolution began.
The governor of Kirinyaga, Governor Waiguru, who is the chair of the Council of Governors, has declined. And probably the reason as to why we're also having issues, we are having problems, is because she's the chair. She's the current chair of the Council of Governors.
The union had issued a 7-day strike notice 7 days ago. In the notice, the union lamented that clinical officers had been struggling with perennial delays of salaries, lack of promotions and resignations, a dire shortage of clinical officers in hospital facilities, and discriminatory contracts. KUSO says that it has followed all legal mechanisms, including issuance of strike notices and unsuccessful conciliation attempts, leaving them with no option but strike.
We have left Kenyatta, we have left MTRH, where clinical officers are actually the ones who are running those facilities right now. So for now, because of those who are critical, we are not going to affect Kenyatta and MTRH. But then if the negligence is going to continue, we will have to ask the patients to look for alternative, because now we'll have to withdraw everybody.
Doctors in the country and referral facilities have already been out for work for more than 2 weeks now, with services expected to be further disrupted in over 4,000 public health facilities across the country.
Tonight, service at 4,172 level 2. Also 1,217 level 3, 3,376 level 4, and also 14 level 5 facility will be disrupted.
Leaders, among them Governor Abdulswamad of Mombasa, have called on doctors in their regions not to allow the problems with the national government to affect the county.
Lakini nilipokuwa nimekaa hapa na ndugu yangu Mng'aro, nikamuuliza kuhusiana na madaktari wa hapa Kilifi na madaktari kule kwetu, na akaniambia hapa mimi nishawalipa mshahara. Nikamwambia hata kule Mombasa hakuna daktari ambaye kwamba anayecheleweshwa mshahara wake. Promotion tulifanya chache, zile ambazo kwamba ziko njiani tunajaribu kuzimaliza. Kama ni madawa tumelipa watu wa KEMSA, tumelipa wale watu wa meds. Kama ni NHIF tumetoa chungu ya pesa. Tunawasihi na tunawaomba madaktari, haya mambo ya kusema ya kwa dhambi ya serikali kuu ibebwe na watu ambao kwamba wako chini, itakuwa ni dhulma. Mtakuwa mnawadhulumu hawa watu. Na kama ni kweli mnahisi ya kwa kuna dhambi nyingine imefanywa kule, basi nakubalini pia mishahara msiweze kuyachukua. Kwa sababu kama mishahara tumelipa, dawa ziko katika hospitali, mamilioni ya pesa tumelipa ya NHIF, tumefanya chungu mzima. Usikie madaktari hawaendi kazini, huijui la kwanza, hulijui la pili, yani mambo ambayo kwamba hayahusiani na watu wa county, hayahusiani na Abdulswamad, hayahusiani na Mung'aro, yenye kuhusiana na mambo ya serikali kuu, naamua tu kwenda. Mimi nitawasihi mlioko hapa, waombeeni Mungu. Mungu awatie imani, kwa sababu watu wakidhoofika afya zao itakuwa ni jambo ambalo kwamba si sawa hata mbele ya Mwenyezi Mungu.